The GBI Medical Examiner's Office provides complete forensic pathology services to 152 of Georgia's 159 counties. Deaths that fall within the guidelines outlined in the Georgia Death Investigation Act are reported to medical examiner investigators by coroners, law enforcement, and hospital personnel. The decision to perform an examination is at the sole discretion of the medical examiner. The GBI Medical Examiner's Office is located at GBI headquarters. In addition, there are satellite medical examiners' offices in Augusta, Macon, Moultrie, Savannah, and Somerville. All deaths fall into one of 5 categories, classified as manners of death. These categories are homicide, suicide, accident, natural, and undetermined. Medical examiner staff work closely with law enforcement and coroner staff to determine the cause and manner of death based on the autopsy findings, the decedent's medical history, and the scene investigation. An autopsy is the dissection of a decedent to determine the cause of death and document injuries that may have caused or contributed to the death. Pathology assistants perform multiple dissections under the medical examiner's supervision in an attempt to locate the cause of death. Vitreous fluid, a clear fluid surrounding the eyes, blood, and urine are drawn from the body and sent to other sections of the crime lab for analysis. Trace evidence, sexual assault kits, and gunshot residue kits can be obtained and sent for analysis. In suspicious cases, the decedent's hands should be bagged in clean paper bags to preserve any potential evidence. Every deceased individual is photographed, and his or her personal belongings are cataloged for release to the funeral home after the examination is complete. Fingerprints are obtained from unidentified individuals and from all homicide cases. The most common method of identification is a visual ID. The decedent is compared to his or her existing photo identification. Identification methods are scientific. A circumstantial identification is not acceptable. Fingerprints and dental records are often used if the decedent is decomposed or burned beyond recognition. DNA typing for identification purposes is employed as a last resort because it is costly and the process is lengthy. Cases that are accepted for examination should always be placed in a body bag on the scene or at the hospital. The decedent and the bag should be labeled with the decedent's identifying information. Cases that are not appropriately labeled and contained in a body bag will not be accepted into the medical examiner's facilities. Ideally, bags should be sealed with a secure evidence tag. Backboards should always be removed from the body bag prior to the decedent's arrival at the medical examiner's office. Evidence of therapeutic intervention should remain on the body so that the medical examiner can properly evaluate the case. Medications located at the scene should always be sent with the decedent's remains, but should not be placed inside the bag with the decedent. All medications accompanying a body are cataloged by a medical examiner investigator and destroyed in a timely manner. Weapons, projectiles, shell casings, and other pieces of evidence should not be sent with the decedent. These items should be packaged and sent to the evidence receiving department to ensure proper chain of custody. The only exception to this rule is a knife embedded in the remains. In these circumstances, the knife should be left in the body so the medical examiner can assess the injury. All ligatures should remain on the body with the knots intact. The GBI Medical Examiner's Office employs a full-time forensic anthropologist to examine skeletal remains. The anthropologist can determine gender, race, approximate age, and approximate height from a skeleton. In addition, the anthropologist inspects the skeleton in an effort to find tool marks, those markings left on a skeleton from a weapon or other object. For the most up-to-date information or answers to any questions this presentation did not address, please call the Regional Crime Laboratory serving your area or go to the GBI Division of Forensic Sciences website.